Phlebotomy last-minute review. Question 1. What is the definition of fomite in an infection control context? Option A. An insect that transmits a virus. Option B. An inanimate object capable of harboring and transmitting infectious agents. Option C. A chemical agent used to sanitize skin surfaces. Option D. A specific type of airborne droplet nucleus. The correct answer is option B, an inanimate object capable of harboring and transmitting infectious agents. A fomite is a non-living object that can carry infectious material from one person or surface to another. Examples include bed rails, equipment, pens, and contaminated trays. Vectors are living carriers, while antiseptics and airborne particles describe different infection control concepts. Question 2. What is the clinical term for an increase in the total number of circulating red blood cells? Option A. Anemia. Option B. Polycythemia. Option C. Leukemia. Option D. Thrombocytopenia. The correct answer is option B. Polycythemia. Polycythemia means an increased total number of circulating red blood cells or increased red cell mass. It can thicken blood and increase thrombotic risk depending on cause. Anemia is decreased red cell or hemoglobin concentration. Question 3. What is the clinical term for blood that has escaped from a vessel into the surrounding tissue layers? Option A. Petechiae. Option B. Hematoma. Option C. Thrombus. Option D. Hemostasis. The correct answer is option B. Hematoma. A hematoma is blood that has leaked from a vessel into surrounding tissue. It may appear as swelling, bruising, or tenderness at the puncture site. Petechiae are pinpoint hemorrhages, while a thrombus is a clot inside a vessel. Question 4. A specimen for a lactic acid test must be handled using which special accommodation? Option A. Placed immediately on an ice slurry. Option B. Incubated at 37 degrees Celsius until tested. Option C. Kept away from all light sources using foil. Option D. Centrifuged immediately within 5 minutes of draw. The correct answer is option A. Placed immediately on an ice slurry. Lactic acid specimens are commonly chilled promptly to slow cellular metabolism after collection. Continued glycolysis can change lactate concentration if handling is delayed. Light protection or warming is used for different analytes, not routine lactate preservation. Question 5. What is the correct protocol for mixing an additive tube after filling? Option A. Shake it vigorously up and down 5 times. Option B. Roll it back and forth between your palms for 30 seconds. Option C. Invert it gently back and forth the recommended number of times. Option D. Let it sit completely still in a rack to mix naturally. The correct answer is option C. Invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 6. What clinical term describes a systemic infection caused by pathogenic microorganisms or their toxins circulating in the bloodstream? Option A. Hematoma. Option B. Sclerosis. Option C. Septicemia. Option D. Petechiae. The correct answer is option C. Septicemia. Septicemia is a systemic bloodstream infection caused by pathogenic microorganisms or their toxins. It is clinically serious because organisms and inflammatory mediators circulate throughout the body. Hematoma, sclerosis, and petechiae describe local bleeding or vessel conditions rather than systemic infection. Question 7. Chain of custody protocols are required for which type of laboratory specimens? Option A. Routine lipid panels. Option B. Therapeutic drug monitoring. Option C. Paternity and forensic drug testing. Option D. Blood cultures for sepsis. The correct answer is option C. Paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 8. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A. Draw the blood quietly without waking them up to minimize pain. Option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C. Skip the patient and mark them as unavailable on the computer. Option D. Ask the patient's roommate to confirm their identity for you. The correct answer is option B. Gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 9. What should a phlebotomist use to cleanse the skin surface prior to collecting a blood alcohol specimen for legal purposes? Option A. 70% isopropyl alcohol prep pads. Option B. Povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Option C. Tincture of iodine solution. Option D. Concentrated hydrogen peroxide spray. The correct answer is option B. Povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Blood alcohol specimens for legal testing should be collected using a non-alcohol skin cleanser such as povidone iodine, chlorhexidine, or soap and water. This avoids any appearance that alcohol from the prep contaminated the specimen. Routine isopropyl alcohol pads are avoided for forensic alcohol collections. Question 10. What type of vessel contains valves to prevent the backflow of blood as it travels back toward the heart? Option A. Artery. Option B. Capillary. Option C. Vein. Option D. Arteriole. The correct answer is option C. Vein. Veins contain valves that help prevent backflow as blood returns to the heart at low pressure. These valves support venous return, especially from the limbs. Arteries carry blood under higher pressure and usually do not need valves along their length. Question 11. What is the primary clinical consequence of warming an infant's heel prior to a dermal puncture? Option A. It decreases the pain perception of the infant. Option B. It increases localized arterial blood flow up to 7-fold. Option C. It sterilizes the deeper layers of the epidermis. Option D. It prevents the formation of an unneeded hematoma. The correct answer is option B. It increases localized arterial blood flow up to 7-fold. Warming an infant's heel increases local blood flow and improves capillary specimen collection. Better perfusion can reduce squeezing, which helps avoid tissue fluid contamination. Warming does not sterilize tissue or eliminate the need for proper puncture depth. Question 12. What type of hazard does the blue quadrant of the NFPA 704 diamond represent? Option A. Flammability hazard. Option B. Reactivity hazard. Option C. Health hazard. Option D. Special or specific hazard. The correct answer is option C. Health hazard. The blue quadrant of the NFPA 704 diamond represents health hazard severity. It communicates the potential for harm from exposure to the material. Red indicates flammability, yellow indicates instability, and white is used for special hazards. Question 13. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A. Expressed consent. Option B. Informed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 14. Which of the following tests is used to evaluate the extrinsic pathway of the coagulation cascade? Option A. Activated partial thromboplastin time, APTT. Option B. Bleeding time test. Option C. Prothrombin time / international normalized ratio, patient / INR. Option D. Complete blood count, CBC. The correct answer is option C. Prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic and common coagulation pathways. They are commonly used to monitor warfarin therapy and assess clotting factor activity. APTT primarily evaluates the intrinsic pathway, and CBC measures cells rather than coagulation pathway function. Question 15. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A, lithium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium fluoride. Option D, ammonium oxalate. The correct answer is option B, ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 16. How should a phlebotomist approach a child who needs a blood test? Option A, tell them it will not hurt at all to gain their trust. Option B, explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C, have 3 guards hold them down before introducing yourself. Option D, show them the largest needle to prove how brave they need to be. The correct answer is option B, explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 17. What type of isolation room requires the air pressure to be lower than the surrounding hallway air pressure? Option A, negative pressure isolation room, airborne precautions. Option B, positive pressure isolation room, protective isolation. Option C, standard contact isolation room. Option D, droplet precaution room. The correct answer is option A, negative pressure isolation room, airborne precautions. Airborne isolation uses negative room pressure so contaminated air flows into the room rather than out to the hallway. This helps contain airborne pathogens such as tuberculosis, measles, or varicella. Protective isolation for immunocompromised patients often uses positive pressure instead. Question 18. Which of the following options defines the proper site for an adult capillary puncture? Option A, the thumb or index finger of the dominant hand. Option B, the lateral or medial plantar surface of the heel. Option C, the palmar surface of the distal segment of the middle or ring finger. Option D, the side of the pinky finger near the cuticle. The correct answer is option C, the palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 19. What is the clinical term for a localized infection or inflammation of the bone caused by accidental needle striking during a heel stick? Option A, osteosarcoma. Option B, osteomyelitis. Option C, osteoarthritis. Option D, osteopenia. The correct answer is option B, osteomyelitis. Osteomyelitis is infection or inflammation of bone. In heel puncture, it can occur if the lancet penetrates too deeply and injures the calcaneus. Proper site choice and maximum depth limits are used to prevent this serious complication. Question 20. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing? POCT, instruments. Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 21. Which of the following blood components is responsible for the initiation of the coagulation process? Option A, erythrocytes. Option B, leukocytes. Option C, thrombocytes. Option D, hemoglobin. The correct answer is option C, thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 22. What color tube top indicates that the tube contains the additive sodium heparin? Option A, light blue. Option B, dark green. Option C, lavender. Option D, light green. The correct answer is option B, dark green. Dark green tubes indicate sodium heparin in many tube systems. Sodium heparin prevents clotting by interfering with thrombin activity and is used for selected chemistry or special testing. Light green usually contains lithium heparin with gel, while lavender and light blue contain different anticoagulants. Question 23. What type of collection is performed to screen for hidden blood in a stool specimen? Option A, occult blood test, GWAC. Option B, culture and sensitivity, C&S. Option C, ova and parasites, O&P. Option D, fecal fat quantification. The correct answer is option A, occult blood test, GWAC. An occult blood test, often using a GWAC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, ova and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 24. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A, powdered latex. Option B, non-powdered latex. Option C, nitrile or vinyl. Option D, cotton utility gloves. The correct answer is option C, nitrile or vinyl. Type I latex hypersensitivity can cause serious allergic reactions, so latex gloves should be avoided. Nitrile or vinyl gloves provide barrier protection without latex protein exposure. Cotton gloves do not provide adequate protection for blood collection. Question 25. What is the primary function of leukocytes? Option A, carrying oxygen to body tissues. Option B, preventing blood loss through clotting. Option C, defending the body against foreign pathogens. Option D, maintaining osmotic pressure in the plasma. The correct answer is option C, defending the body against foreign pathogens. Leukocytes are white blood cells that defend against infection and foreign material. They include several cell types involved in immune response, inflammation, and pathogen destruction. Red cells transport oxygen, platelets support clotting, and plasma proteins help maintain fluid balance. Question 26. When using a butterfly winged infusion set with a light blue top tube, why must a discard tube be drawn first? Option A, to clear any residual skin surface contaminants from the needle. Option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Option C, to activate the coagulation cascade prior to sample collection. Option D, to check if the vein has adequate pressure to fill a full tube. The correct answer is option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 27. What is the standard duration for an administrative scrub or hand washing when preparing for routine patient contact? Option A, 5 seconds. Option B, 20 seconds. Option C, 1 minute. Option D, 3 minutes. The correct answer is option B, 20 seconds. Routine hand washing before patient contact should last at least 20 seconds. This duration allows adequate friction and contact time to remove transient microorganisms. Very brief washing is ineffective, while surgical scrub times are reserved for different procedures. Question 28. Which of the following factors can cause hemoconcentration during a blood collection procedure? Option A. Leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Option B. Releasing the tourniquet as soon as the first tube begins to fill with blood. Option C. Utilizing a needle with a large lumen, such as a 21-gauge needle. Option D. Having the patient remain in a supine position for 20 minutes before the draw. The correct answer is option A. Leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Leaving a tourniquet on for several minutes causes venous stasis and fluid shifts out of the vessel. This concentrates cells and analytes, producing hemoconcentration. The tourniquet should be released within the recommended time and reapplied only after an appropriate pause if needed. Question 29. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A. The needle will slip and miss the vein entirely. Option B. The red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C. The patient's blood pressure will drop rapidly. Option D. The vacuum inside the collection tube will increase significantly. The correct answer is option B. The red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 30. Which of the following is considered an acceptable site for venipuncture if antecubital veins are unavailable? Option A. The dorsal aspect of the wrist. Option B. The dorsal aspect of the hand. Option C. The anterior aspect of the foot. Option D. The saphenous vein in the ankle. The correct answer is option B. The dorsal aspect of the hand. Dorsal hand veins are an acceptable alternate site when antecubital veins are unavailable. They are more superficial but may require a smaller needle and careful anchoring. Wrist, foot, and ankle sites carry greater risk and often require special approval. Question 31. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 32. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A. Change the requisition manually using a pen to match the verbal statement. Option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C. Draw the blood and sort out the labeling discrepancy later in the lab. Option D. Assume the patient knows their own name and print a new label on the spot. The correct answer is option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 33. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A. Gown, gloves, mask, goggles. Option B. Gloves, goggles, gown, mask. Option C. Mask, gown, goggles, gloves. Option D. Goggles, mask, gloves, gown. The correct answer is option B. Gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 34. If a phlebotomist must collect blood from a patient with an active, running 4-line in both arms, what is the preferred option? Option A. Draw the blood from a capillary puncture if the tests allow. Option B. Turn off the for yourself and draw above the line immediately. Option C. Draw from the foot or ankle without a physician's order. Option D. Postpone the draw indefinitely until the patient is discharged. The correct answer is option A. Draw the blood from a capillary puncture if the tests allow. When both arms have running 4 lines, venous sampling near either infusion may be diluted or contaminated. If the ordered tests permit capillary collection, skin puncture can avoid the active infusion sites. Turning off force or using lower extremity veins requires nursing or provider direction and facility policy. Question 35. Which of the following is an example of an engineering control designed to reduce the risk of needle stick injuries? Option A. Wearing a laboratory coat. Option B. Utilizing self-sheathing safety needles. Option C. Hand washing after every procedure. Option D. Disposing of waste in a biohazard trash bag. The correct answer is option B. Utilizing self-sheathing safety needles. Engineering controls are built-in safety devices that reduce exposure risk by design. Self-sheathing or safety-engineered needles help prevent needle stick injuries after use. Lab coats and hand hygiene are work practice or PPE measures, not engineering controls. Question 36. What color top tube is used to collect specimens for blood bank immunohematology testing like antibody screens? Option A. Pink top or glass red top. Option B. Gray top. Option C. Light blue top. Option D. Light green top. The correct answer is option A. Pink top or glass red top. Pink EDTA tubes or glass red tubes are commonly used for blood bank immunohematology testing such as antibody screens. These specimens support red cell typing and compatibility testing. Gray, light blue, and light green tubes serve glucose, coagulation, and chemistry testing needs. Question 37. What is the function of sodium polyent whole sulfonate, SPS, inside a yellow top blood culture tube? Option A. To inhibit the growth of bacteria. Option B. To preserve glucose levels for bacterial metabolism. Option C. To aid in bacterial recovery by inhibiting complement and phagocytosis. Option D. To lyse red blood cells to release intracellular pathogens. The correct answer is option C. To aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 38. What type of specimen is generated when a blood sample collected in a plain red top tube is allowed to clot and then centrifuged? Option A. Plasma. Option B. Serum. Option C. Whole blood. Option D. Fibrinogen-rich extract. The correct answer is option B. Serum. Serum is produced when blood is allowed to clot and the clotted specimen is centrifuged. It is the liquid portion remaining after fibrinogen and clotting factors are consumed in clot formation. Plasma requires an anticoagulant and still contains clotting factors. Question 39. What type of specimen is required for a plasma hemoglobin test? Option A. Serum separator tube, SST. Option B. Plain red top tube. Option C. Heparinized or EDTA plasma free of hemolysis. Option D. Whole blood collected in a gray top tube. The correct answer is option C. Heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 40. What color top tube contains the additive EDTA and is the primary tube used for a complete blood count? CBC. Option A. Lavender top. Option B. Light blue top. Option C, green top. Option D, grey top. The correct answer is option A, lavender top. Lavender tubes contain EDTA and are the primary tubes for CBC testing. EDTA prevents clotting while preserving blood cells for accurate counts. Serum or heparin tubes do not provide the standard specimen required for routine CBC analysis. Question 41. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A, separating the serum from the red blood cells within 30 minutes of collection. Option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C, transporting the specimen to the laboratory on an ice slurry. Option D, utilizing a grey top tube containing sodium fluoride to collect the sample. The correct answer is option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 42. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A, high levels of lipids, fats, circulating in the blood. Option B, extensive hemolysis from using a small needle. Option C, elevated levels of direct and indirect bilirubin. Option D, failure to mix an anticoagulant tube after drawing. The correct answer is option A, high levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 43. If a patient is receiving an intravenous 4 infusion in the right arm, where should the phlebotomist attempt to draw blood? Option A, directly from the foreline itself. Option B, from the left arm. Option C, above the foresight on the right arm. Option D, from the hand on the right arm. The correct answer is option B, from the left arm. Drawing from the opposite arm avoids dilution or contamination from the fore-infusion. For fluids, medications, and additives can alter test results if sampled from the same side. Drawing directly from the line or above the infusion site requires special authorization and is not routine phlebotomy practice. Question 44. What tube additive prevents clotting by binding or chelating calcium? Option A, lithium heparin. Option B, DDTA. Option C, sodium polyethylene sulfonate. Option D, thrombin. The correct answer is option B, EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 45. What does a trough level measure in therapeutic drug monitoring, TDM? Option A, the highest concentration of the drug in the patient's system. Option B, the lowest concentration of the drug, measured right before the next dose. Option C, the average concentration of the drug over a 24-hour window. Option D, the amount of drug excreted through the kidneys. The correct answer is option B, the lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 46. What color top tube contains the additive thrombin, which acts as a rapid clot activator for stat serum determinations? Option A, orange top. Option B, light blue top. Option C, lavender top. Option D, gray top. The correct answer is option A, orange top. Orange top tubes contain thrombin, a rapid clot activator used for some stat serum determinations. Thrombin speeds clot formation so serum can be processed quickly. Anticoagulant tubes such as lavender, gray, and light blue are intended to prevent clotting rather than accelerate it. Question 47. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A, hemoconcentration of the plasma. Option B, hemolysis of the red blood cells. Option C, complete inhibition of clotting factors. Option D, falsely elevated platelet counts. The correct answer is option B, hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 48. What clinical condition is characterized by a high accumulation of bilirubin in the blood, causing a yellowing of the skin and sclera? Option A, cyanosis. Option B, jaundice, icterus. Option C, erythema. Option D, pallor. The correct answer is option B, jaundice, icterus. Jaundice, also called icterus, results from elevated bilirubin levels in blood and tissues. It causes yellow discoloration of the skin and sclera. Cyanosis, erythema, and pallor describe blue, red, and pale color changes from different causes. Question 49. Which of the following is an example of a vector-borne transmission? Option A, contracting a cold from an airborne sneeze. Option B, acquiring a skin infection from a contaminated countertop. Option C, getting bit by a mosquito infected with West Nile virus. Option D, drinking water containing bacterial toxins. The correct answer is option C, getting bit by a mosquito infected with West Nile virus. Vector-borne transmission involves a living carrier that moves an infectious agent from one host to another. Mosquito transmission of West Nile virus is a classic example. Airborne droplets, contaminated surfaces, and contaminated water represent other transmission routes. Question 50. Which of the following additives is used to preserve glucose stability by preventing its breakdown by red blood cells? Option A, sodium citrate. Option B, sodium fluoride. Option C, lithium heparin. Option D, ammonium oxalate. The correct answer is option B, sodium fluoride. Sodium fluoride preserves glucose by inhibiting glycolysis in blood cells. This slows cellular consumption of glucose after collection. Citrate, heparin, and oxalate alone do not provide the same glycolysis inhibition. Question 51. Which of the following elements is critical to include on a manual handwritten specimen tube label? Option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. Option B, patient's insurance policy number and diagnosis code. Option C, phlebotomist's full signature and room number. Option D, name of the ordering physician and laboratory phone number. The correct answer is option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. A manual tube label must clearly identify the patient, the collector, and the collection timing. Full name, date of birth or other unique identifier, date, time, and phlebotomist initials support traceability. Insurance data, diagnosis codes, and physician phone numbers do not replace specimen identifiers. Question 52. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A, gray top, sodium fluoride. Option B, light blue top. Option C, lavender top. Option D, green top. The correct answer is option A, gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 53. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 54. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A, dropping a needle into the sharps box immediately after withdrawal. Option B, pushing down on items inside a full sharps container to make extra room. Option C, disposing of a sharps box when it reaches the indicated full fill line. Option D, placing the sharps container at eye level near the point of use. The correct answer is option B, pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 55. Which antiseptic is recommended for a patient undergoing a skin puncture for a blood culture if they are allergic to chlorhexidine? Option A, 70% ethyl alcohol. Option B, povidone. Option C, hydrogen peroxide. Option D, benzalkonium chloride. The correct answer is option B, povidone. Povidone is an appropriate alternative when chlorhexidine cannot be used for blood culture skin preparation. It provides broad antimicrobial activity when applied and allowed to dry according to protocol. Hydrogen peroxide and benzalkonium chloride are not standard substitutes for this purpose. Question 56. What condition can occur if blood is drawn from an arm on the same side as a recent radical mastectomy? Option A, syncope. Option B, lymphedema and altered test results. Option C, petechiae. Option D, sclerosed veins. The correct answer is option B, lymphedema and altered test results. The arm on the side of a recent radical mastectomy may have impaired lymph drainage and increased risk for swelling. Blood collection there can worsen lymphedema and may also produce altered results from compromised circulation. The unaffected arm or an approved alternate site should be used whenever possible. Question 57. What type of isolation precautions must be followed when entering a room to draw blood from a patient with an active vancomycin-resistant enterococcus, VRE, infection? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, protective reverse isolation. The correct answer is option C, contact precautions. VRE is commonly spread by direct contact with contaminated hands, surfaces, or equipment. Contact precautions use gown, gloves, and dedicated equipment to reduce transmission. Airborne and droplet precautions are reserved for respiratory spread. Question 58. If a phlebotomist must use a syringe to collect blood, what device should be used to transfer the blood into vacuum tubes? Option A standard needle attached to the syringe puncturing the tube top directly. Option B, a syringe transfer device with a shrouded needle. Option C, pouring the blood from the syringe barrel after removing the stopper. Option D, injecting it through a butterfly needle set. The correct answer is option B, a syringe transfer device with a shrouded needle. A syringe transfer device allows blood to move safely from a syringe into vacuum tubes without exposing the needle. The device reduces needle stick risk and helps maintain tube vacuum and fill order. Removing stoppers, pouring blood, or puncturing stoppers with an exposed needle is unsafe. Question 59. Which of the following tests evaluated the intrinsic pathway of the coagulation cascade and is used to monitor heparin therapy? Option A, prothrombin time, patient. Option B, activated partial thromboplastin time, APTT. Option C, bleeding time test. Option D, fibrin degradation products, FDP. The correct answer is option B, activated partial thromboplastin-time, APTT. APTT evaluates the intrinsic and common coagulation pathways and is used to monitor unfractionated heparin therapy. Heparin prolongs clotting activity measured by this test. Patient and INR are more associated with warfarin and the extrinsic pathway. Question 60. Which of the following tubes should be collected first when performing a venipuncture draw using a multisample needle? Option A, light blue top, sodium citrate. Option B, blood culture bottles or yellow SPS tube. Option C, red top, serum. Option D, green top, heparin. The correct answer is option B, blood culture bottles or yellow SPS tube. Blood culture bottles or yellow SPS tubes are collected first in a multisample draw. This protects the culture from additive carryover and supports sterile organism recovery. Coagulation and other additive tubes follow in the established order of draw. Question 61. What does the term homeostasis mean? Option A, the stoppage of blood flow from an injured vessel. Option B, the steady state or dynamic balance of the body's internal environment. Option C, the destruction of old red blood cells in the spleen. Option D, the production of new cellular elements in the bone marrow. The correct answer is option B, the steady state or dynamic balance of the body's internal environment. Homeostasis is the body's dynamic process of maintaining internal stability. It includes regulation of temperature, fluids, pH, glucose, and other physiologic variables. Hemostasis is specifically the stopping of bleeding and is a different term. Question 62. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option A, light blue top. Option B, lavender top. Option C, grey top. Option D, green top. The correct answer is option C, grey top. Grey tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing grey tubes too early increases additive carryover risk. Question 63. What is the minimum amount of time a serum separator tube, SSD, must stand in a vertical rack to clot completely before centrifugation? Option A, 5 minutes. Option B, 10 minutes. Option C, 30 minutes. Option D, 90 minutes. The correct answer is option C, 30 minutes. Serum separator tubes usually need about 30 minutes upright to clot fully before centrifugation. Spinning before clot completion can produce fibrin strands and interfere with serum separation. Waiting too little risks poor specimen quality, while excessive delay may affect some analytes. Question 64. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A, complete blood count, CBC. Option B, blood cultures. Option C, erythrocyte sedimentation rate, ESR. Option D, C-reactive protein, CRP. The correct answer is option B, blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 65. Which of the following conditions can cause a specimen to appear cloudy, milky, or white after centrifugation? Option A, extensive hemolysis from using a small gauge needle. Option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Option C, icterus caused by elevated levels of circulating bilirubin molecules. Option D, failure to invert an additive tube immediately after collection. The correct answer is option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Lipemia causes serum or plasma to appear cloudy, milky, or white because of high lipid concentration. It may result from non-fasting status or lipid metabolism disorders. Hemolysis and icterus cause red or yellow discoloration rather than milky turbidity. Question 66. What type of patient environment requires protective, reverse isolation protocols. Option A patient with an active, contagious respiratory flu virus. Option B, a patient with an open, draining MRSA wound infection. Option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D, a patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 67. What color top tube is used to collect specimens for lead testing? Option A, tan or royal blue with EDTA. Option B, light blue. Option C, light green. Option D, yellow. The correct answer is option A, tan or royal blue with EDTA. Lead testing requires tubes certified to be low in trace metal contamination, commonly tan or royal blue with EDTA. Ordinary stoppers and additives can contaminate trace element specimens. Light blue, green, and yellow tubes are selected for different testing needs. Question 68. What clinical condition is characterized by fluid accumulation in the intercellular tissue spaces, making the arm swollen? Option A, lymphedema or edema. Option B, petechiae. Option C, sclerosis. Option D, hematoma. The correct answer is option A, lymphedema or edema. Lymphedema or edema describes swelling from fluid accumulation in intercellular tissue spaces. It may occur after lymph node removal, obstruction, injury, or other circulation problems. Drawing from a swollen limb can be difficult and may produce unreliable specimens. Question 69. Which of the following tubes contains the anticoagulant lithium heparin? Option A, light green top, PSD. Option B, dark blue top. Option C, yellow top. Option D, gray top. The correct answer is option A, light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 70. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A, it breaks the vacuum seal of the multisample tube. Option B, it can cause permanent damage to underlying nerves and blood vessels. Option C, it dulls the needle tip and makes skin entry painful. Option D, it causes the patient's blood pressure to spike excessively. The correct answer is option B, it can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 71. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A, green top. Option B, light blue top. Option C, lavender top. Option D, yellow top. The correct answer is option A, green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 72. Which of the following parameters must be strictly managed when collecting an arterial blood gas (ABG) sample? Option A, protecting the syringe from exposure to direct light sources. Option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. Option C, inverting the syringe 20 times to mix the clot activator. Option D, using a gray top tube to transport the arterial blood. The correct answer is option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. ABG specimens are time-sensitive because blood gases and pH can change after collection. The sample must be transported and analyzed promptly according to facility requirements. Delays, air bubbles, or improper temperature handling can distort oxygen, carbon dioxide, and pH values. Question 73. Which of the following tests is part of a routine liver function panel? Option A, creatinine. Option B, alanine aminotransferase, ALT. Option C, hemoglobin A1c. Option D, troponin I. The correct answer is option B, alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 74. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 75. What is the major drawback of using a needle with a gauge size of 25 or higher for venipuncture? Option A. It causes severe tissue tearing upon skin entry. Option B. It carries an extremely high risk of causing hemolysis in the sample. Option C. It penetrates too deeply into the bacillic structures. Option D. Vacuum tubes will lose their suction pressure entirely. The correct answer is option B. It carries an extremely high risk of causing hemolysis in the sample. Very small needles, such as 25 gauge or higher, can damage red cells as blood is forced through a narrow lumen. This increases hemolysis risk and may compromise chemistry results. Larger needles are not always appropriate, but extremely small gauges are avoided for routine venipuncture. Question 76. What clinical term describes the liquid portion of a blood specimen that has been allowed to clot completely before centrifugation? Option A, plasma. Option B, serum. Option C, whole blood. Option D, buffy coat. The correct answer is option B, serum. Serum is the liquid portion of blood after the sample has clotted completely and been centrifuged. It lacks fibrinogen because fibrin clot formation has already occurred. Plasma is obtained from anticoagulated blood. Question 77. Which of the following conditions can lead to a lipemic specimen? Option A. The patient did not fast before a lipid panel draw. Option B. The specimen was hemolyzed during collection. Option C. The tube was left under direct light for too long. Option D. The patient was severely dehydrated. The correct answer is option A. The patient did not fast before a lipid panel draw. Lipemia often occurs when blood is drawn after recent dietary fat intake, especially before lipid testing. The serum or plasma may look cloudy or milky from circulating lipoproteins. Hemolysis causes a red tint, while icterus produces a yellow to amber color. Question 78. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A, routine cholesterol screen. Option B, workplace drug testing. Option C, blood culture for endocarditis. Option D, complete blood count for anemia. The correct answer is option B, workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 79. Which of the following parameters can cause a false decrease in bilirubin levels if a sample is handled improperly? Option A, over-isotonic chilling. Option B, exposure to direct room light or sunlight. Option C, inverting the tube more than 10 times. Option D, delays in serum separation beyond 4 hours. The correct answer is option B, exposure to direct room light or sunlight. Light exposure breaks down bilirubin and can produce falsely decreased results. Specimens for bilirubin testing should be protected from strong light soon after collection. Chilling, inversion count, or routine separation delays do not cause the same light-driven degradation. Question 80. Which of the following conditions can cause a specimen to be rejected due to icterus? Option A. Falsely high fats in the patient's diet. Option B. High concentrations of bilirubin in the serum or plasma sample. Option C. Excessive destruction of red cells inside the tube due to rough handling. Option D. Utilizing the wrong color top tube during collection. The correct answer is option B. High concentrations of bilirubin in the serum or plasma sample. Icterus describes a yellow to amber serum or plasma appearance caused by high bilirubin concentration. It can interfere with certain laboratory methods and may lead to rejection or result comments depending on severity. Lipemia and hemolysis create cloudy or red appearances rather than bilirubin-related discoloration. Question 81. If a patient experiences syncope during a venipuncture, what should the phlebotomist do first? Option A. Call for an emergency code. Option B. Complete the current tube collection. Option C. Remove the tourniquet and needle immediately. Option D. Place a cold compress on the patient's forehead. The correct answer is option C. Remove the tourniquet and needle immediately. Syncope during venipuncture requires immediate protection from further injury. The tourniquet and needle should be removed first so bleeding and needle movement do not continue while the patient loses consciousness. Completing the tube collection is never the priority during a fainting episode. Question 82. Which of the following is the most critical step in performing any phlebotomy procedure? Option A. Choosing the correct size needle. Option B. Verifying patient identification. Option C. Selecting the appropriate vein. Option D. Applying the tourniquet tightly. The correct answer is option B. Verifying patient identification. Patient identification must be verified before collection because every result is linked to treatment decisions for one specific person. A name alone is not enough when facility policy requires two identifiers such as full name, date of birth, or medical record number. Needle size, vein choice, and tourniquet technique matter only after the patient's identity has been confirmed. Question 83. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A. Droplet transmission. Option B. Contact transmission. Option C. Airborne transmission. Option D. Vector-borne transmission. The correct answer is option C. Airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 84. A fasting specimen requires that the patient does not consume food or beverages, except water, for how many hours prior to collection? Option A. 2 to 4 hours. Option B. 4 to 6 hours. Option C. 8 to 12 hours. Option D. 18 to 24 hours. The correct answer is option C. 8 to 12 hours. Many fasting specimens require 8 to 12 hours without food or beverages other than water. This window helps remove recent dietary effects on glucose, lipids, and related analytes. Shorter fasting may not stabilize results, while much longer fasting can create other metabolic changes. Question 85. If a patient feels faint during a draw and has already passed out, what is the best position to place them in once safety measures are met? Option A. Prone position. Option B. High Fowler's position. Option C. Supine with legs elevated or flat. Option D. Standing upright with assistance. The correct answer is option C. Supine with legs elevated or flat. After immediate safety steps, a fainted patient should be placed flat or supine with legs elevated when appropriate. This position helps restore blood flow to the brain and reduces injury risk. Standing or sitting upright can worsen syncope and lead to falls. Question 86. Which organization regulates safety conditions in the workplace, including exposure to blood-borne pathogens. Option A, CDC. Option B, FDA. Option C, OSHA. Option D, CLSI. The correct answer is option C, OSHA. OSHA sets and enforces workplace safety requirements, including rules for blood-borne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 87. Which of the following represents an occupational exposure route for a blood-borne pathogen? Option A, blood splashing into a phlebotomist's eyes. Option B, touching an intact skin surface with clean hands. Option C, inhaling air in a well-ventilated laboratory room. Option D, spilling saline solution onto a lab bench. The correct answer is option A, blood splashing into a phlebotomist's eyes. Blood splashing into the eyes is an occupational exposure because mucous membranes can transmit blood-borne pathogens. Eye protection is used when splash risk exists to prevent this route of exposure. Contact with intact skin or clean surfaces does not carry the same exposure risk. Question 88. What does the term basal state refer to in clinical laboratory testing? Option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B, the physical state of the body directly following a heavy workout session. Option C, the point of highest metabolic activity in the afternoon. Option D, the body state while under heavy psychological stress. The correct answer is option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 89. When centrifuging specimens, what is the most important operational rule to follow? Option A, centrifuging serum tubes immediately before they clot. Option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Option C, leaving the lid open slightly to prevent overheating of the tubes. Option D, setting the speed to the maximum RPM regardless of tube type. The correct answer is option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Centrifuge tubes must be balanced with similar volume tubes opposite each other. An unbalanced load can damage the centrifuge, break tubes, and create aerosol or biohazard exposure. Opening the lid during operation or using maximum speed without regard to specimen type is unsafe. Question 90. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A, patent vein. Option B, sclerosed vein. Option C, superficial vein. Option D, tortuous vein. The correct answer is option B, sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 91. What is the correct order of draw for a multitube venipuncture sequence involving a coagulation tube, a blood culture, and a hematology tube? Option A, light blue, blood culture, lavender. Option B, blood culture, light blue, lavender. Option C, lavender, light blue, blood culture. Option D, blood culture, lavender, light blue. The correct answer is option B, blood culture, light blue, lavender. Blood cultures are collected first to maintain sterility, followed by light blue coagulation tubes and then lavender hematology tubes. This order reduces contamination and additive carryover. Drawing EDTA before citrate can interfere with coagulation results. Question 92. Which of the following practices is critical to perform when collecting a specimen for a cold agglutinin test? Option A, keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Option B, chill the tube in an ice slurry immediately after drawing. Option C, protect the specimen from light by wrapping it in heavy foil. Option D, centrifuge the tube immediately within 2 minutes of collection. The correct answer is option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Cold agglutinin specimens must be collected and kept warm at about 37 degrees Celsius. Cooling can cause antibody-mediated red cell agglutination before testing and distort results. Pre-warmed tubes and warm transport preserve the specimen condition needed by the laboratory. Question 93. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act? HIPAA. Option A, discussing a patient's laboratory results with the ordering physician. Option B, discussing a patient's lab results with a colleague in the hospital cafeteria. Option C, entering patient information into an encrypted laboratory information system. Option D, sharing critical panic values with the nurse assigned to the patient. The correct answer is option B, discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 94. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C, document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 95. What is the standard gauge size of a needle used for routine adult venipuncture in most clinical settings? Option A, 18 gauge. Option B, 21 gauge. Option C, 25 gauge. Option D, 16 gauge. The correct answer is option B, 21 gauge. A 21 gauge needle is commonly used for routine adult venipuncture because it balances adequate flow with acceptable patient comfort. It is large enough to reduce hemolysis risk in normal veins. Smaller gauges may be used for fragile or small veins, but they are not the routine default. Question 96. What type of fire extinguisher should be used on an electrical fire occurring in a laboratory centrifuge? Option A, Class A. Option B, Class B. Option C, Class C. Option D, Class D. The correct answer is option C, Class C. Class C extinguishers are used for energized electrical equipment. They are designed to suppress fire without conducting electricity back to the user. Water-based Class A extinguishers can be dangerous on electrical fires. Question 97. Which of the following tubes contains a clot activator paired with a thixotropic gel barrier designed for serum separation? Option A, light green top, PSD. Option B, gold or red /black marbled top, SST. Option C, lavender top, EDTA. Option D, light blue top, sodium citrate. The correct answer is option B, gold or red /black marbled top, SST. Gold or red black marbled SST tubes contain a clot activator and thixotropic gel for serum separation. The clot activator speeds clot formation, and the gel forms a barrier after centrifugation. PSD tubes produce plasma because they contain heparin instead of a serum clotting system. Question 98. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 99. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A. Collecting a lavender top tube for a CBC test. Option B. Submitting an underfilled light blue coagulation tube. Option C. Delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D. Affixing a handwritten label over a pre-printed barcode label. The correct answer is option B. Submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 100. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A. Proceed immediately to get the draw over with quickly. Option B. Instruct the patient to take slow, deep breaths and offer reassurance. Option C. Reschedule the test for a different week. Option D. Administer a sedative if available in the room. The correct answer is option B. Instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist.